Therapy Corner. Today, we are very pleased to have with us Dalila Santa Cruz, who is a licensed marriage family therapist. She actually does a lot of things. She's a counselor over at Allen Hancock College in their health center, serving the students of Allen Hancock. She also teaches for Allen Hancock College. And she holds down a private practice working for Optimal Interventions. So she's a busy little gal. She's going to be here today to talk about EMDR. And I'm going to have her explain it to you. Okay? So, welcome, Dalila.
Thank you, Oli. Thanks for inviting me. So I'm very pleased to be here. So yes, EMDR, what EMDR stands for is eye movement, desensitization, and reprocessing. So it's a type of therapy used to treat traumas. In life, we have many traumas, and in the EMDR therapy or therapy world, we have sometimes little traumas and big traumas. So I know it sounds a little interesting, but big traumas can mean like catastrophes, for example, going to war, having someone who suffered PTSD, major car accidents. Now, little traumas are, on the other hand, more like perhaps everyday events, even childhood events. For example, if someone was bullied as a child, something else happened, maybe domestic violence. Sometimes that could be a big trauma, but in most cases it's considered a little trauma. So what EMDR does, it helps the individual not be as traumatized. So what the therapy does, it sort of desensitizes a person from having the traumatic experience. So the beauty of EMDR is when they do come to session, first the therapist does take a good history information, making sure they are good candidates for EMDR, because EMDR is good therapy, but it's not for everybody. As an example, say if we have someone that is anorexia, that is suffering from anorexia, that individual, because they are so deprived, their brain is so deprived from nutrients to their brain, they are not going to be able to function in doing EMDR therapy. Because EMDR therapy, even though it's short-term therapy, you actually process a lot. So in some cases, you can work with someone who has anorexia, but you have to work with their primary provider, making sure that they're okay, that they're eating correctly and taking all the vitamins. And maybe in those cases, if they're healthy, at healthy weight too, then we can work with someone like that. The other, that I had a couple of students, someone who's intoxicated. We want someone intoxicated in session, first of all. But if someone does come, for example, that is using marijuana, and their marijuana is so intense that they're using so intense that it depletes their memory, their mind from actually functioning and being successful with EMDR therapy, that's where we sort of stray away. That doesn't mean that they cannot use it in the future. They can. It's just kind of a caveat. They do prevent us from working with individuals in such situations. The other one, too, is someone who might have suffering from epilepsy. I did have someone who suffered from epilepsy, but I also contacted the neurologist, making sure that they were a good candidate. For example, sometimes using EMDR therapy, and I'll explain a little more, they can get triggered. Mm-hmm. They can get triggered. So when someone gets triggered, it might give them more of the epileptic, shocks. So when someone is in that situation, we try to stay away from them as well. But, of course, we contact the neurologist, making sure that they're candidates, and then we also work with them.
Okay, so first off, I'm going to back you way up here, Dalila, because I appreciate the overview of what EMDR does and can do. But you said something I think that's really important there. It's not for everyone, and
correct.
Not everyone is trained in it.
Yes,
so
true. Yes, I forgot.
You've been through the training.
So the training is they do prefer someone to be trained by the institute, EMDR Institute. It's EMDRIA. The reason for that, because it's actually like boot camp for therapists. It's a very beautiful. It's a 3-step process. First, you go to part 1 training, where they give you the training, the overview of what EMDR is, with the facilitators, a trained facilitator, and then also you do the practicum. So you do the practicum there in session in vivo with another therapist, and you have to work on some of your own issues. That can be a little bit frightening for a lot of therapists, but it's something that you can get through.
Sure.
So that's part 1, and the facilitator does come and observes you, making sure that you are following the steps correctly, the EMDR steps, because there is 8 steps of doing EMDR therapy, and I'll talk a little bit more about that later on. So that's part one, and then you have to complete training hours, meaning you have to do own EMDR therapy with the clients, and then get your own EMDR therapy, because I think that's a benefit, so you can experience it yourself as a clinician. And then part two is a little bit more intense. You bring case studies, you perhaps talk about them, very similar to part one, but it's a little more intense. And then the last part is you go with a consultant, whoever is a consultant in the area. There's many consultants here in Santa Maria, Santa Barbara, also San Luis Obispo, and they probably will work with you more on cases, more intense, more interventions, and then that's how you will be approved by EMDR. It's difference between certified or certification. So when you become EMDR certified, you have to have your master's degree. You have 200 hours in EMDR therapy, and there's a little bit more that goes with that. But the beauty about that is once you become certified, you can go and see if you can become a facilitator yourself and provide trainings for clinicians who are interested in doing EMDR therapy themselves. Yes.
So you've been doing that since 2011? Then?
Yes.
Oh, wow.
But I'm in the process of getting certified, because it's a process, but it's a worthwhile process.
Yeah, I know that EMDR has been sort of touted as the go-to therapy for people with PTSD. And there's been some controversy over the effectiveness of EMDR, but I know that, and I forget the name of the person who started the whole movement.
Francine Shapiro.
Thank you, Francine Shapiro. And she said that part of the problem with the research where it showed it wasn't as effective was that the people had not been trained properly.
Correct. Yes, and that's why she recommends being trained by the Institute, because these are approved clinicians that are trained, and you can also reach out to them, your consultant, almost like your coach, a coach that you could reach out for them if you have any case consultation, a client that you're working with, and all. And the beauty about EMDR, it's one of the therapies that is mostly researched. So it's approved by APA, Department of Defense, and then there's more. And it is considered evidence-based because of the research that's out there.
Right.
So it's amazing. It's amazing. The work that I've done with some of my clients in private practice, also at the community college, I've just seen, my goodness. I wonder to them, okay, is it helping this individual? And they come and they're like, yes, I don't have these symptoms anymore. For example, if someone comes in and they have a trauma, for example, of trauma of driving in the freeway, for example. Usually, what the clinician would do is say, okay, what does this remind you of anything else? They're like, no, I just have anxiety. So driving in the freeway. So what the clinician will do is pretty much, take an assessment, work on the emotion that they're having if they don't have no memory, and any body sensations. Because it's a mind and body type of therapy. A little bit of Gestalt, a little bit of existential therapy, a little bit of CBT, all and it's combined into one. And so, the therapist can sort of maneuver where they need to go, not necessarily going through all the phases of the EMDR therapy, but where they need to go with that client. For example, like the one that is afraid to drive in the freeway, we usually work with any emotion, any body sensation. And once we do that, usually there's a memory connected to something related to perhaps driving in the freeway, or perhaps an accident that they saw as a child. We don't take information or we don't put information in. This is something that the individual does on its own. We let their brain do whatever it needs to do naturally.
So it's sort of a subconscious process that takes place during the time you're doing the therapy.
Yes, kind of.
You're kind of allowing them to sometimes, I'm going to say, retrieve or remember a memory that may have in fact caused the trauma.
Yes, correct, yes.
But in a desensitized state, so it doesn't bring back the pain.
Correct.
Is that what I'm hearing?
Yes, correct, yes.
Okay.
And when the therapist is properly trained, EMDR, we always prepare the client. We always prepare them. We give them resources. So for resources can mean, okay, who can you call if you get triggered? Or we create like a safe place. We create guides or resource networks of people that they can look up to when they're feeling stressed out. So we use that with EMDR, meaning, say, for example, someone is afraid of public speaking. So I say, okay, so when you're afraid of public speaking, what does that say about you? They're like, oh, that I can't do this, that I'm a failure. I'm like, okay, so who in your life do you feel like is very successful? So they can bring a positive image. Say, for example, if it's, I don't know, someone famous, or maybe like Mother Teresa. I'm like, okay, so bring Mother Teresa, think of Mother Teresa. So when you think of her, what do you notice in your body? They're like, oh, I feel a sense of relief. So when they do that, then that's when we can come in and do the bilateral movement. The bilateral movement can either be knee taps. This one's a very famous one. Follow my fingers.
Right.
Or the tappers. I have the little tappers.
Oh.
The tappers, what they do, you hold them on the palm of your hands. And what they do, they vibrate back and forth. Sometimes if people don't like that because they just don't, it doesn't feel comfortable, I have them do gentle butterfly hugs that we call. Yeah, and that's very popular with the children. Do the butterfly hugs. So that's what we do to kind of help them, process the trauma, having those positive resources so they won't get triggered when they leave the office.
Gotcha.
Yeah.
Okay, so you mentioned earlier short term. So EMDR really isn't a long-term therapy. It's more like you have trauma, it's interfering with your life, let's fix that. Now, there may be other issues going on.
Yes.
And so I heard you talk about Gestalt and
Yes.
existentialism and things like that. So you're obviously trained in other things besides EMDR. I mean, you're a licensed marriage family therapist, so you have a foundation in other therapy. So you would use the EMDR specifically for their traumatic issues, and then if there's other things, move into that?
Yes.
Or could actually the therapy end with the EMDR sessions?
Yeah, it can. It really depends how long they've gone with the untreated trauma. So it is meant to be a short-term therapy because we just work on the traumatic events. But sometimes in doing the session, it's almost like an onion. You peel it and there's more stuff coming forward. So in those situations, it can take a little longer, like a year perhaps. And that's when it can be more long-term therapy. The other thing too, I have worked with individuals, with therapists that are treating someone. They're working on something else, but they need someone, the person to work on the trauma. For example, if we have rape victims. So we work on the rape and then the therapist takes care of whatever else the client is working on. And that, of course, needs to be with approval from the therapist and both consent to the treatment of the client. That is, the treatment modalities are not going to interfere with each other. So that, yes, EMDR can just be on the specific trauma or other things that do come up in life. For example, future events, that's something very popular in EMDR, like athletes, performance anxiety. So we do sort of like a future template that we call it in EMDR, using the bilateral stimulation in their future events. So we can say something like, okay, so how do you imagine yourself winning this game? And if they're anxious, they're like, oh, what if I don't succeed? If this doesn't happen? I'm like, okay, so just allow yourself to feel that, and it kind of allows them to release the anxieties that they might be having, and then we sort of work with that. And then if the session is complete, meaning that they don't have no other disturbing images, then we go with the future template, meaning, so how do you see yourself performing? Kind of like with the Mother Teresa situation that I explained. I'm like, so visualizing yourself in the future, how do you see yourself?
Interesting. Very interesting. I want to just go back and touch on something because you brought up something that was really, to me, very important, that usually, ethically, a client cannot see two therapists
Correct.
for the same problem. It creates a conflict, and that's not a healthy thing to do. But you said they would be coming to you specifically for trauma work and using EMDR. Now, they could be still continuing in a therapeutic process with another therapist, and that's okay. And I think that message really needs to get out there real loud and clear.
Yes,
Because
I agree.
there are times, so for instance, I may be seeing someone and suddenly, a past sexual abuse issue comes up, and that trauma may get in the way, actually, of continuing with the other therapy that we're doing. So I could refer this person to you, and you could do the EMDR, and then I could continue on with therapy.
Absolutely.
Okay, excellent. Okay, so what happens in a therapy session with EMDR?
So what happens is, of course, we get information, history information, and I always like to also look at, like, if their birth, not, how was a pregnancy with their mom? Did the mom have a traumatizing pregnancy? What was that like? So that's why, like I mentioned, EMDR therapy uses a lot of like psychoanalytic theory. So we kind of take history. We take a thorough history, then we prepare the individual of what this therapy is about. We give them the caveat: it might get worse before it becomes better. Given that, but we also give them resources. This is what you could do if you get triggered. You go to your safe place. Use your resources, the meditation, do whatever you need to do to take care of yourself. Know that this is part of the process, reassuring them. And then what we do, when the person comes into session, we usually connect the image. Okay, so if you have something that's traumatizing, what's the image that you're getting with it? And is there an emotion connected to it? And usually there is. And sometimes I'm like, okay, so what does that say about you when they're having this image? They're like, that I can't succeed. And that's usually connected to perhaps something earlier on in life. So when we do that, we try to also install a positive, like, okay, so what would you like to believe about yourself? That I could succeed. I'm like, okay, great. So we usually have them hold that together. So usually the image, the body sensation, and the emotion, and then we do the tapping. It's usually 30 seconds, so 30 seconds of the eye movements or the tapping, whatever the person's comfortable with. We have them stop and ask them, so what do you notice now? We don't put nothing in, none of that. We just let the client do whatever they need to do naturally with their brain. And usually the session is sort of resolved in the first session. So how it's resolved when we ask the client, so how disturbing is this image or this emotion on a scale from 0 to 10? We use scaling, and they usually come with a 10. And perhaps towards the end of the session, they'll have like a 2. So it's lowered. So usually in session, you'll see them lowered. And you could also see it by their body language. So that's where the clinician sort of pays attention to that, making sure that, they're okay, that the processing is being effective. And of course, sometimes you will have occasions where it's too much for the client. It's too overwhelming. They become too flooded where they can't really deal with it. So we always are very respectful. We're like, if you cannot deal with this, just tell me to stop, and we'll stop. We'll revisit this again some other time. And that's what we do.
Yeah, I would imagine it's very difficult for people when they have these deep feelings of trauma associated sometimes with shame and guilt and feelings of inferiority and not being able to deal with it. It's got to raise up some pretty ugly ideas and thoughts that would make it very difficult.
Absolutely.
And I like what you said about respecting their levels of ability to deal with it and going, okay, we can stop now, and giving them control of the session.
Yes.
So you let them proceed at their own pace.
True.
I also like what you said, which was really interesting, because I love Elizabeth Loftus and her work on memory work and not putting memories in there. I was very disheartened here recently to find that a woman who had come to me had been to another therapist who had instilled the idea that she had been, in fact, molested as a child. And it's like, she says, I don't have any memory of that. I don't have any sense of trauma from that.
Yes.
And so it's
so
very, very nice to hear somebody say, we don't instill thoughts or lead the person. We allow them to bring it forward at their rate.
Yes.
In whatever they can handle.
Absolutely.
Okay. So what else would you like to say in terms of how long does it take?
So it's usually, the theory is 90 sessions.
90? 90?
90 minutes, I'm sorry.
Oh, 90 minutes.
Not 90 minutes,
okay.
But usually that doesn't happen.
Wow. Yeah, I was going to say an hour and a half.
It's not, in our area, it doesn't happen. So realistically, 45 to 50 minutes it does. What I experience, and true to most EMDR therapists, they can probably say this too, clients, they also process on their own. When they leave our office, any type of therapy, they do processing on their own. And that's when they go home and they sleep and, during REM sleep, they do processing similar to EMDR, as Francine Shapiro quoted. It's similar to REM sleep. You process. So we are creating sort of, you're in a like dual attention, meaning you're awake, but you're here and you're processing. That's why that's the purpose of the bilateral movement, because you're sort of processing it in your brain naturally. So allow it to go to its adaptive resolution naturally, without us putting stuff in that does not belong there. Yeah.
I know when I teach, one of the things that I really enjoy talking about is Einstein. He's my favorite guy. I quote him a lot. And one of the things that he used to do is when he was having a problem figuring something out, he'd either take a nap or sleep on it, and
perfect.
Then it would come to him, allowing the unconscious to do the work. And so that's kind of like what you're doing, isn't it?
Yeah.
I mean, with the tapping and all that, you're allowing the unconscious to do the work. And if it isn't completed, it's something they can do, as you say, on their own.
Yes.
Maybe when they're sleeping.
Yes. Yeah. Absolutely. Or take a walk. When you're going through something and you take a walk and you usually feel better. Mm-hmm. Yeah, so allowing it to mentally digest in its own natural way. Yeah.
Mm-hmm. I like the way you say that, because we tend to oftentimes think of therapy as this boogie-woogie thing.
Yes.
And it's like, no, this is like talking to your best friend, only they really are your best friend, because they will say the things that you don't want to hear.
Yes.
And in this way, you're also just being a best friend and saying, hey, you've got some severe trauma here.
Yes,
You've just told me.
Yeah.
Let's see if we can help you in a very natural, loving, supportive way. Have that trauma come out on its own.
On its own, yes. And the beauty with EMDR, they don't have to do a lot of talking, because a lot of the times when someone suffers from a severe trauma, as an example of rape, it could almost re-traumatize them again. Not just them, but sometimes even the therapist can become traumatized or burned out. So with the EMDR, they don't have to do that.
Yeah.
Talking about the trauma details in itself they don't even have to mention it. They just process.
They can process it in their own heads.
Yes.
So they don't have to actually say, I was pinned down, I was, beaten, I was, forcibly raped. They don't have to actually say those words. They can actually just process it in their head while they're working.
Correct, because it could bring shame. And then when it brings shame, that's when they perhaps put their wall and they're like, no, I don't want to go there. And it can be too much for them, too overwhelming.
Yeah, I've experienced some of that myself with some of my clients. Both of the things you've said, sort of interesting. One, when they talk about it, it's almost like re-traumatizing them. And I feel horrible, but it's something they feel they need to talk about, and I allow them to do that. Yes. But the other thing is also, I can't tell you how often I've come to tears in a session with a client where what they've said has been, so overwhelming to me.
True, yes.
And again, at some point in another of our little videos here, we can talk about self-care for therapists.
True.
Because sometimes we get traumatized.
We need it, it's a lot that we do.
So where can people go to get help with EMDR?
So they can go under EMDR. If you type in EMDR, and then it'll have, you can find a therapist, local therapist. And
can you spell that? So
yes.
It sounds like you're saying Andrea.
No. It's EMDRIA.org. And they can find a therapist there. Also, too, there's also very good resource information. There's actually a 9-minute video on EMDR. Okay. They explain a little bit more about EMDR. So it's a really great resource. They have a lot of information on PTSD, and it's just, for students, it's probably something very useful as well.
Mm-hmm. Well, you brought a couple of books with
you.
Maybe you'd like to hold those up so people can see them.
So this book...
and talk about it a little bit.
This book is actually a client and also became a therapist. It's the EMDR Revolution. And it basically talks about the different therapies. It kind of like cognitive behavioral therapy and also EMDR. Okay. So it compares, compare and contrast. This? Good? Okay. So this is one that is useful for clients, even therapists. I read it. I really like this book. So it's a nice, easy read. And the next book, this is by our latest Francine Shapiro, and this is one of her latest books. So this is a nice book. Right here, is that good? Not so sure. And this is another one that clinicians can use. So if they're interested in finding perhaps getting EMDR trained, they can get a look at this. And it has.
And so this is written by the person who started the whole EMDR.
Yes.
Do you happen to know how she got started?
Oh,
with
that's
it?
interesting.
Just
It's
curious.
awesome. Well, EMDR did get started like in the late 80s, 1980s, 87, I believe. So she was a grad student going for her dissertation, and she actually got cancer. And she noticed that, and this is what she wrote in her dissertation, that when she had disturbing images or thoughts, she went and took a walk. And she noticed that as she was walking, that is kind of bilateral, moving your left foot, right foot, we hope, right? She noticed that her eyes were moving back and forth, that there's a REM. When we do during REM sleep, we process. So she noticed that she did that, she continued to walk, the images were less disturbing to her, and it helped her. And then that's when it went and they researched more, and it helped her, and then it was actually used for war veterans. And later on they found that trauma not only affects war veterans, but also affects other individuals. That's where the big traumas and the little traumas come in place.
I know it's the go-to therapy for folks coming back from war zones with PTSD and severe trauma. But I'm also hearing, which is really important for I think people to hear, is that it's also good for what we may consider little trauma. But it's very personal, isn't it, whether you consider it
absolutely
trauma or not.
Yeah, because it's how they got locked in that nervous system at that age that perhaps the individual was. For example, if they were a small child, how the trauma was locked in their nervous system. So with the EMDR, it kind of helps reactivate the nervous system, which is the amygdala, the hippocampus, and the prefrontal cortex. So that's helps, and it helps them process the trauma naturally.
Yeah. By the way, I do want to bring up to the audience that Dalila is bilingual.
Oh, that's right.
So she can help the Hispanic population as well, both with EMDR and regular therapy.
Regular therapy. Yes, talk therapy.
So anyway, it's just been an absolute delight having you on the show and explaining EMDR to me. I personally don't do EMDR. I'm not trained in it, and I won't do anything that I don't know. So I really appreciate you coming on and explaining
it's an honor.
it.
Thank you so much. Appreciate it. Thank you.
So again, continue with your work and try to get some rest.
I will.
Sounds like you work way too much.
Thank you. I will.
All right. Thank you,
so
Dalila.
much. Thank you. Have a nice day. All right.
So again, thank you for visiting with us today on the Therapy Corner, and we look forward to you coming again and sitting in and listening and viewing our tapings here. This is for you. This is something we do to help you to understand and appreciate mental health and well-being, and understand different concepts, ideas in psychology, and hopefully bust a few myths here and there that we have about different types of therapy. This is for you. So if you have any comments, if you have any questions, concerns, etc., please feel free to send us an email at the email address that's here at the end of our show. So again, thank you for watching. Take care, and I wish you all good mental health.